So we want together, jointly, work as a team and point our arrows forward on addressing these challenges. So we have also a responsibility towards building partnerships and resource mobilizations as one of our functions. And we are leading the efforts of mobilizing resources domestically through National Assembly for Cancer, and we are also mobilizing privately through the partners, both locally and international community. Last, I think 3 or 4 months ago, Mheshimiwa, we had a meeting with the chairpersons of all county health assemblies. And the reason we had a meeting in Naivasha from all the 47 counties, because we also acknowledge that counties have health budgets. And Dr. Waome, as you plan, cancer had been a neglected disease for a long time. But if we honestly are appreciating that cancer is one disease that is posing the biggest burden, then we should also allocate the most resources. During the corridors and the streets and media houses, when the finance bill was being discussed, even when the Gen Zs came to the streets, cancer was mentioned evidently from the leadership in the country that we need this finance bill so that we are able to finance through Social Health Authority, cancer. While on the other side, the Gen Zs were saying, you are taxing a lot, including taxing cancer drugs. So everybody had, an interest towards making sure the cancer agenda is moving forward. So I did have an in-depth discussion with chairpersons of health committees at the county assemblies, and they appreciated that we are one of the first state corporations to call county assemblies to discuss matters that are of interest. And I want to believe you will continue advancing that cause while you will be discussing on your county budgets. And Dr. Waome, you can insist with your colleague at the executive that we get more allocation to cancer from the county, so that as we support, you have also demonstrated goodwill at home, right? Yeah. So it is important. Our other function is advocacy to make sure there is adequate financing for cancer. So working with Social Health Authority, we participated heavily to take care of the interest of cancer in the 3 funds, and I'm glad the court extended the stay order yesterday to allow us at Ministry of Health to still provide evidence and legitimize why we need all the 3 laws, because one of them is Social Health Insurance Act, which then creates for Social Health Authority to exist. Because we do agree that it's better than NHIF, because NHIF is just equivalent to SHIF, which was one fund, but then now we have Primary Healthcare Fund, and we have Chronic Disease, Critical Illness and Emergency Fund, which is an addition, and there is so much that addresses cancer issues, both at the Primary Healthcare Fund on screening. We are currently, maybe from Dr. Leah, I do not know how active your histopathology department is at the Meru County Referral Hospital. We are also working on building more capacity at the National Cancer Reference Laboratory in Nairobi to support counties that do not have diagnostic capacity, where specimen can be sent to Nairobi. And for a long time, our laboratory has not been optimized. But right now, we have put in efforts to make sure that if you lack pathology services, if you lack, analysis of specimen, and even as we work towards conducting research in the community, we may consider specimen that we are collecting from the community, either from, soil, from water, from human subjects, and we need to analyze them. So we have to provide mechanisms of making sure we can analyze this data. So we do provide a lot of advocacy to make sure our patients are financially protected. It is expensive to treat cancer, we agree. Social Health Authority provides, in fact, the winners. If we are able to finance the entire SHA, the greatest winners are those patients who are diagnosed with cancer. But then we don't want them to be diagnosed with cancer. We want to prevent, and we want them to be diagnosed early, where if an opportunity presents itself, they can even be treated, when it's precancerous. And if it's cancer, it be stage 1 or 2 that can be treated with surgery alone. Or if we must include chemotherapy and radiotherapy, then those services should be available so that we can improve treatment for our patients, we can reduce morbidity and mortality, and we can increase productivity economic-wise in our communities. Our children to go to school, families to have food, because I have faced real realities where a patient asks you, I do not have money to come to the hospital. I don't have transport. And that then means I don't have food. My children have dropped off school. Very sad, picture. Social Health Authority would address this. We also have an opportunity from the National Cancer Institute of Kenya to build capacity in oncology workforce. This year, we have committed some little resources towards competitively sponsoring a few healthcare workers. And many a times, I have refused to believe that cancer care can only be better because we have an oncologist. We need a whole team. A whole team. Those guys who are in a multidisciplinary tumor board, we are more than 20 of us in that board. And we need to build capacity, either curriculum-based or non-curriculum-based, in all those healthcare workers. So we shall soon be sending out an advert for application, and we are going to vet competitively, just like we will be sending out a call for cancer research, and all of us will be free to apply. Vetting is very open. We are going to guide on what thematic areas we want, for us to focus. We are really interested in making sure we turn around the cancer agenda in this country, because that is why we exist. We do not have another job. If you ask Dr. Wawome here and our County Director of Health here, you have so many things to deal with beyond cancer. I sympathize with you guys. If we have challenges and we are dealing with one disease, I want to believe you have more problems than I do. But we wish you well as you address them. All right? Finally, we have a responsibility to protect the rights of those who are diagnosed with cancer. Okay? Because treatment of patients with cancer, either complications from the disease or complications from treatment, whether it's chemotherapy, surgery, or radiation, or they can be debilitating. And sometimes these patients face a lot of challenges. We had a recruitment at the National Cancer Institute in the past couple of months. And among applicants were patients diagnosed with cancer. And we actually gave them an opportunity to be part of the staff, because then they will make us at the institutional level appreciate from a personal experience what we should be doing. But then there are many people who are out there looking for jobs, and sometimes they are sent away by virtue of having been diagnosed with cancer. There are some who are denied opportunities in education. You can't sit for exams, you are not in class. There are some who are denied even credit, that facilities, that you have cancer, because people are stigmatized that you will die before you pay our loan. So we have to stand out and make sure we protect, even issues to do with disability, we are able to provide guidance. All right? So I want to summarize from our functions at that point in the interest of time. I thought it's important to engage you from that perspective so that you can understand our role, because I know there are people who today probably they are hearing of National Cancer Institute of Kenya for the first time. There are some who have heard, but they were not very sure. What does it do exactly? There are some who are wondering, how then can we benefit from this institution? So it was important to mention that, so that even as we now listen to you briefly on what are your priorities as Meru County, where we can partner and work together, then you know what we are able to offer. All right? So allow me to, end at that point, as I continue to appreciate an opportunity to engage you, to discuss with you. And I had mentioned earlier on that we serve under the oversight of a board of trustees, and our chair of the board is Dr. Githinji Gitai. He is a key personality in the health space in this country, regionally and globally. We have the opportunity to have 9 other board of trustees, where Dr. Kadere is one of them. And we have governance structures in the institution to make sure we are able to provide services as per the guidance of the law. So thank you very much for creating time to listen to us. We are here to jointly solve a challenge that is a priority to all of us in the offices that we serve. Asante sana.
Thank you. Let's give